a score for you to assess your patient. So IDF is International Diabetic Federation, and DA is Diabetic and Ramadan Group. So this is the group that is responsible for most of the studies we can now rely on in coming up with advice for our patients. So the calculator can be found at that website. So what does this calculator entail in risk stratification? Okay. These are 14 risk categories. These are 14 items. We can quickly go through so that you get a feel of what we are looking for when we are trying to score the risks for our clients. So number one is what type of diabetes? Is it type 1 or type 2? And you can observe that type 1 gets a score, meaning there's greater risk of injury if you're a type 1 diabetic and opt to fast. What's number 2? Duration of diabetes in years. How long have you had diabetes? The longer you've had diabetes, the greater the score and the greater the risk. What about the presence of hypoglycemia? These are top marks here, from 1 to 6.5. So for an individual who is unaware of their hypoglycemic status, that's a top score of 6.5. What about individuals who've had multiple episodes of low blood sugars prior to Ramadan? That's 3.5. Recent hypoglycemia, 5.5. So this is a top scorer. What about level of control? If you are well controlled, you score 0. That's an HbA1c below 7.5. What about poor control? Any level above 9%, you score a 2. Self-monitoring of blood glucose. Is an individual indicated to do self-measurement of blood glucose but doesn't do the same? Top score, 2. If an individual is not indicated to do the same, 0. Okay, so the ability to perform self-monitoring of blood glucose matters in our risk stratification. What about complications? DKA in the last 3 months, honk in the last 3 months. These are top scorers as well. What about comorbidities? Okay, big vessels. Okay, major vessel disease. These are vessels of the brain, vessels of the heart, kidneys. Unstable, major vessel disease, 6.5. That's a top score. Stable, major vascular disease, a score of 2. Okay, what about kidneys? Various scores from 6.5 to 0. What about pregnancy? Pregnant and not within sugar targets, 6.5. Okay, physical labor. What about previous Ramadan experience? What were your experiences fasting during the last Ramadan? If it was overall a negative experience, you score a 1. What about the geographical location? Does your fasting hours extend 16? Yes, a score. So to aid us stratify risks to our patients and try to advise them whether to fast or not. Okay. So how are the scores awarded? A score of 0 to 3, that's low risk. A score between 3.5 and 6, moderate risk of fasting. Any score above 6 is high risk of complications while fasting. So what are the implications of these scores? What is the advice we give to our patients having these individual or these various scores? For the high-risk patients with a score of over 6, we advise them not to fast. They should not fast categorically. Those with a score between 3.5 and 6, we advise them not to fast. Advise not to fast. Those with low risk, we allow to fast. Now, this is the recommendation of the health practitioner. These are the recommendations of the imams, the spiritual leaders. The ultimate decision lies with the patient. We've just stratified the patient's risk, and we've advised them the risk category, and we've advised them accordingly whether categorically they should not fast, whether they are advised not to fast, or whether it is permissible for them to fast. However, the final decision rests with the patient. So what is upon us to partake for those individuals, despite the categorical warnings of the risks involved in fasting, despite the religious permission to opt out from fasting? What of the individuals who, despite all that, opt to fast? The 40% type 1 diabetics, the 80% type 2 diabetics. What is upon us in walking with them through their fast? The notion of pre-Ramadan assessment and training. Now, this is what is highly emphasized by Diabetes and Ramadan Study Group for the individuals who opt to fast Ramadan. And it is recommended that these measures start 3 to 8 weeks prior to Ramadan. Okay, so about 2 months prior to Ramadan, we need to engage our clients in pre-Ramadan assessment. Okay, we check the patient's history, their comorbidities, kidneys, any history of stroke, any family history of cardiovascular disease. Are there already pre-existing complications of diabetes, retinopathy, nephropathy, neuropathy? Okay. DM treatment. What treatment is the patient on? Is it on just dietary management, lifestyle management? Is it on oral medications? Is it combined oral and injectables? What are the levels of sugar control? Are the patients at target? Are the patients out of range? And most importantly, the patient's ability to measure sugars while at home. Okay. Now, these are the pillars. These on your screen are the pillars of the pre-Ramadan education and assessment, which start well before Ramadan by at least 2 months. Okay? Removing misconceptions. There are a few misconceptions out there pertaining to self-measurement of blood glucose at home while in the state of fasting. Does it invalidate my fasting or not? What about insulin injections while in the state of fasting? Does it invalidate my fast or not? What about regular workups, lab works during fasting? Does it invalidate or not? So this is the period before Ramadan. We reflect and we spend some time with our patients addressing such misconceptions. Medication adjustment. Whatever meds you are in before Ramadan might not be the medications you'll end up taking while in Ramadan. Okay, some medications come with higher risks of hypoglycemia than others. So the period for adjustments in medication happens way before Ramadan. During this period, glucose monitoring. This is the time to advise on self-measurement of blood glucose. This is the time to follow up on the patients that are already on SMBG, which is self-measurement of blood glucose. This is the time to closely follow up blood glucose. So ideally, for any patient living with diabetes, opting to fast the month of Ramadan, it is highly imperative, very important to be able to measure glucose at home while in the state of fasting. Glucose monitoring, we enforce good practices during this time of pre-Ramadan education and training. Okay, dietary advice. This is where we involve our nutritionists in dietary advice to our Muslim clients who intend on fasting. How to adjust their diet, their current diet, in anticipation for Ramadan. I'm glad Chair Lady is a nutritionist and she can highlight some of the important aspects of diet in Ramadan. Physical activity. We monitor the levels of activity of our patients before Ramadan. If they're into aggressive, intensive, strenuous exercise, we advise them not to do so during the period leading to Ramadan. We train our patients on how to recognize symptoms of both hypoglycemia and hyperglycemia. This is the period to do so, not while we are already in Ramadan. And very important, when do we advise our patients to break their fast? So these are the core entities that need to be addressed in the pre-Ramadan education. And this is a period 6 to 8 weeks leading up to Ramadan. Okay, so what are the symptoms of hypoglycemia? What are the symptoms a patient might experience if their sugar levels drop quite low? Tremors, sweating, a feeling of hunger, palpitations, awareness of heartbeat, headaches, fatigue, and change in mental status. What of hyperglycemia? A feeling of hunger again, frequent urination, fatigue, extreme thirst, altered mental status, nausea, or vomiting. So these are symptoms we need to train our patients to be aware of, to be familiar with, to be on the lookout for during the period of fasting. On the dietary element of the pre-Ramadan assessment, how does diet change during the month of Ramadan? Ramadan is a pillar of Islam. Ramadan is an act of worship. It is on the same breath a festival. It's a festivity. Okay, so there is pomp in some of the Muslim households. There's pomp. There's food, abundance of food, there's abundance of drink, there's sweets and all that. So we globally we observe that there's large iftar. Iftar is the meal just at the break of the fast. At sunset, we call that meal iftar. So lots of carbohydrates and sugars. And the meal just at dawn before the commencement of fast, it's called suhoor. Okay, the suhoor is also large in some Muslim households, and the predominant food item in all of these meals are carbohydrates. Those aside, there's frequent snacking between breaking of fast to commencement of the following day's fast. So Muslims break fast at around 6:30, they have dinner, and there's a few hours between the breaking of fast and the commencement of the next day's fast. And this period, it is custom, it is tradition to indulge. So, and the item most common on Muslim household table are sweets. Okay, so all these, I'm looking at hyperglycemia in all of these items. Okay? Now, this is a study done in 2005. Before Ramadan, it is lots of calories from main meals, snacks predominant, fat and carbs. This is outside Ramadan, okay? Calorie loaded. What happens during Ramadan? The scale tips lower and deeper into more fats, more carbs, okay, and more snacks. So this is a typical Muslim household during Ramadan. So the concern for hyperglycemia is real during the hours of eating.